So for my semester of A&P, I had decided to talk about the cardiovascular system out of all the systems that we've studied so far this semester. I chose this mainly because I am pretty familiar with it because my dad, he has heart disease and he has had a surgery for it. The cardiovascular disease is a classification of diseases that involve the heart or the blood vessels leading to the heart. There are a lot of them. There are like 50 different types of heart diseases. I chose mainly to talk about coronary artery disease. I chose this because it seems to be like the most common type of heart disease, and that's the kind of heart disease my dad has. But coronary artery disease is when the blood flow in the vessels to the heart don't get the normal blood flow. Like usually it's pumping to the heart and like out of the heart, but the plaque buildup that happens in like the walls of the arteries is what it restricts the flow to the heart, so it's not getting as much blood as it's supposed to be, so it can't efficiently pump. But the plaque that is deposited in the walls of the arteries are mainly made up of cholesterol. But when those walls are filled with this plaque, it narrows the arteries, constricting the blood flow to the heart. And when the heart doesn't get enough blood flow, it causes things like chest pain or discomfort, which is also commonly called angina in the scientific term. Which it happens a lot on the left side of the body. But coronary artery disease can be caused by several different things. Hereditary, that is a big factor because it is hereditary. Like I think it could pass through generations. Also, being overweight and obese can cause coronary artery disease as well as high cholesterol, blood pressure, diabetes. Diabetes, I think, is what caused my dad's heart disease, so watch out. But to diagnose the heart disease, healthcare providers can keep track of the blood pressure, cholesterol, and sugars along with different types of testing. The main types of testing are an ECG, which is electrocardiogram, an echocardiogram, a stress test, like a chest x-ray, and a heart catheter. The ECG is what measures the electrical activity rate and regularity of heartbeats. The echocardiogram uses ultrasound to create a picture of the heart. A stress test is what they use for having someone jog on a treadmill, and it kind of determines whether the heart is able to efficiently pump enough blood to keep that exercise going. And then the chest x-ray, it takes pictures of the heart to see what's going on. But I feel like the most common one and the most effective one is a heart catheter. A heart cath checks for the blockage in the arteries by inserting a tube through an artery. You can do it in the groin, the arm, or in the neck. But that's mainly to check the blood flow of the heart, the blood flow to each of the chambers. I do know that often they do the one in your groin because it's a lot easier to get to it. But there is a procedure that can fix this disease. I mean, it can't really fix it, but it can help minimize the chances of having a heart attack. This is called a bypass surgery. The bypass surgery is very, very big. It's a big procedure and it takes a long time. But how that happens is they're going to give whoever, a patient, the anesthetic that's going to put them under basically their heart's not beating, their lungs aren't pumping themselves, so the heart and the lungs are hooked up to a machine that make it move because the person's basically dead. But this incision is going to be across here and down the chest. And so they're going to cut the sternum this way to open up to get to the heart. And the surgery is They're called grafts. They're gonna take like arteries out of your mammaries. There's one in your leg, like the great saphenous. They take that out, and they're going to graft like a bypass on the heart, which is going to create a new way of blood flow throughout the heart. But it's this takes a very long time. It takes probably about 4 to 6 hours, and then after the procedure, the patient's going to be put in the ICU for a day or two. Like, it's very like fast healing, not really, but they'll like intubated the hot chest tubes and stuff like that to help drain. But typically the patient will stay 3 to 7 days total before they're able to go home. But I do have this heart pillow to show what it does. This is what they give you at KU Med. It's probably backwards, but they give you this, so like whenever like a patient is coughing, they're supposed to like hold it up to them and like cough, or if they're getting up by themselves, they're supposed to use this to stand up and kind of like hug it like a pillow. But yeah, healing, it takes a long time because the sternum is wired back together, and so they're really not used to not having all that together. But yes, that is the cardiovascular system for you.